Riedels thyroiditis, which is a form of chronic thyroiditis and is also known as fibrous thyroiditis or Woody's thyroiditis or invasive thyroiditis. There is extensive fibrosis of thyroid gland with replacement of thyroid parenchyma by fibrous tissue. Despite extensive fibrosis, thyroid dysfunction is uncommon and sign symptoms are due to compression of different structures around that. Extensive fibrosis disturbs normal gland architecture and function, and it may lead to hypothyroidism, hypoparathyroidism, and compression symptoms. It's a rare chronic painless thyroiditis, insidious in onset. Fibrosis fixes the gland to the surrounding structures. Riedel thyroiditis is the manifestation of multifocal systemic fibrosis syndrome. So what are the features of thyroid gland on examination? Features of thyroid gland are that it's asymmetric, is stony hard, non-tender, painless, fixed goiter, adherent to surrounding structure in the neck, and mimics carcinoma of the thyroid gland. What are the structure compressed by fibrosis? Trachea, esophagus, neck veins, and recurrent laryngeal nerve. And what are the compression symptoms? Dyspnea, dysphagia, dysphonia, coughing, choking, and hoarseness. Hoarseness due to recurrent laryngeal nerve involvement. When does dyspnea occur? Dyspnea occurs when more than 70% of trachea is obstructed. And what tests demonstrate esophageal obstruction? Barium swallow. It typically occurs in middle-aged women between the ages of 30 to 60. Riedels thyroiditis is associated with focal sclerosis syndrome. There is an association of Riedels thyroiditis with idiopathic fibrosis on the other sides like retroperitoneum, mediastinum, biliary tree, lungs, and orbit. And diagnosis? Diagnosis is done by open biopsy to exclude malignancy. Treatment is surgical relief of compressive symptoms, chemotherapy with tamoxifen. Methotrexate and steroid are also helpful. Thyroid hormone are given only for sign symptom of hypothyroidism.